welcome everyone to tonight's presentation. Tonight we're taking a trip, all right? We're taking a trip to Las Vegas. No, I'm kidding. We're taking a trip down the Vegas Nerve, all right? We're calling this our Vegas vacation. We're halfway through our series here at the office in regards to our workshops. And we're taking a vacation here being summer. Now, we need to be talking about what Vegas is all about. So my first question I'm gonna have tonight to start you all off is, what comes to mind when we think about Vegas? Now, there's no wrong answer to this one. You can answer it yourselves however you like. Okay. I'm gonna throw at you what I think Vegas looks like, all right? This is what comes to mind with Vegas. You got gambling, sports gambling, rolling the dice, taking a chance. We're talking about, card games. You got your Baccarat, your 21, your the Texas Hold'em. You've got War, we call it back home, where it's you deal a card, I deal a card, highest card wins. We've got the lights, we've got the chances, as I said, the risk, we've got the fast-paced action, all right? That's what Las Vegas means to me. So I think we all think about that, that's kind of what it means, right? Yeah, exactly, okay. So what comes to mind when we think about this word just here of Vegas, all right? So Vegas in that regard. No, so not V-E-G-A-S, we're talking about V-A-G-U-S. Has anyone ever heard about it before? This is where our vacation starts right here. Nah, okay, that's all right. So what comes to mind when we think about the vagus nerve is something that typically we've seen a lot. In the past, say 10 to coming up 15 years, okay? It was all the craze for a while. I'm gonna tell you all about it, okay? Most people, when they think about Vegas, they think about this. They think about the polyvagal tone, all right? You may have heard about it, you may not have, all right? But what we're talking about tonight is what that thing is, how it became such a huge fad, and then what it's all about. So 2001, it was written by a doctor named Stephen Porges, right? His big thing was unlocking the link between the nervous system and things like trauma, anxiety, depression, as well as adaptive behavioral and social strategies behind it. So how our body and our nervous system is related to things like anxiety, stress, trauma, our childhoods, our behavioral patterns, our social strategies to get through them, and how it's all related from past experiences the nervous system relies upon. So it's almost like an ability that you remember. Now I want you to keep that in mind, okay? All right? There's a key term in chiropractic world, pardon me, that talks about how you remember things. All right, we're gonna talk about that in a second. The thing about that book was the fact that since 2011, so we're coming up 15 years, near enough, is that influencers around the world took it and ran with it. Now, when I say the influencers, I'm sure you think of your YouTubers, your Facebooks, your Instagrammers, your TikToks, all that sort of stuff. They took it and ran wild with it. And when I say it, they took the work that Dr. Stephen Porges did, and they created things out of like challenges, hard 60s, hard 75s, where it's, you gotta work out twice a day for 75 minutes. You have to drink 2 gallons of water, things like that. There was apps and smartwatches and technologies that came with it. So people wear Fitbits and different smartwatches and sleep cycles and Whoops and things like that, where those are different apps that came around from it, where people took that theory of your body's ability to start to generate things or from its previous experiences to balance itself out, and they came about that way. So it turned this huge tide into what's going on. And lastly, there was like those mindset motivators, how you sit there and you think about 3 things that made you happy today, 3 things that made you sad today, 3 things that made you angry today. It was those mindfulness moments that were created. As I said, influencers around the world took it and they spread it like wildfire based on vagal tone or polyvagal theory. With that being the case, there was a lot of things that came out, and we're going to touch on them as we go forward. Some of the stuff you might have heard of was the brain-gut connection. It was a huge one a few years ago about how the brain and the gut talks to each other. There was a lot more that came out of this, and the reason why I say that is because guess what? All right? Pardon me, sorry, my computer's just been a bit of a glitch. Just give me 1 second, I'm so sorry for this. Chiropractic has been talking about this for over 100 years. So Dr. Stephen wrote this book, like I mentioned. Chiropractic has been talking about it for over 100 years, which is incredible to think about. So the fact that it took this major, this major book and this major phase by storm within the world, but chiropractic's been talking about it for over 100 years, and I'll explain why. What the heck is the vagus nerve? All right, let's start off with that point. Let's start with all good things. What the heck is it? We have to define it, right, before we even know what it is. The vagus nerve is the 10th cranial nerve of a total of 12 nerves. So you've got 12 cranial nerves that sit here. Now they are the optic nerve, they are the olfactory nerve for your smell. There is the oculomotor, there is the vestibulocochlear, which is for your hearing. There is the facial nerve, there's the accessory nerve, there's the hypoglossal nerve, is all that. But the vagus nerve is used for two things. Now each of them directly emerge from the brain. And what they are used for is two things, sensory and motor. All right, keep those in mind, sensory and motor. Now there's always two things that come when it comes to the nerve itself, but those are the two aspects that it is. They receive the information from areas and send it back to the brain. It is in charge of two pathways of your nervous system. Those two pathways, I'll show you in 1 second, based upon what the vagus nerve is, the anatomy look like. It's a bifurcated nerve, so you've got two of them, and they run down the side of your neck. So when it sits here, in that first bone of your neck just here, this is the vagus nerve. It comes out of the brain, travels down, and goes down throughout the body. Now, like I mentioned before, there's the glossopharyngeal nerve, the accessory nerve as you go forward. Now, those are also cranial nerves, but as you can see, this vagus nerve travels down and it actually sits right next to the first bone in your neck. Now, it's very important as a chiropractor that I'll show you shortly why that is the case. I mentioned before, what does vagus do? It controls two nervous systems in your body. I like to break it down very easy. The go, 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 and the whoa, Nelly. All right? So fast, 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 slow, slow, slow. However you want to remember it. Gas pedal, brake pedal. All right? Up high, down low. However you want to break it down, that's what it's in charge of. The two systems, the go, 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 is known as the sympathetic nervous system. That is in charge of the fight or flight. All right? We've all heard of that term before, fight or flight. Take it head on or run away. That's the sympathetic nervous system. The parasympathetic nervous system does the opposite. It calms us down. So that's why I say the go, go, go and the whoa, Nelly. Gas pedal, brake pedal. Those two systems are controlled by the vagus nerve. Now, the vagus nerve does so much. That's why it's so important. That's why we're going through this vacation tonight, to try and show you why it's so important and how it relates to your overall health. Where does the vagus nerve go? It goes to everything. It literally goes to everything. And actually on this previous slide just here, you can literally see it. It travels down from here all the way down throughout your nervous system. It travels from the top bone of your neck all the way down to around about your diaphragm and comes straight back up. But it does so much for that. The reason why I say that, as you can see here, it automatically controls the parasympathetic motor functions of the heart, the lungs, the digestive system, the liver, the gallbladder, the spleen, the pancreas, and the kidneys. Think about that. All of those things are controlled by that one nerve. Now you have trillions of nerves in your body, but it is controlling all those things via that one nerve path route. All right? This means that the vagus nerve has the very important job of stimulating the rest and digest. So that was the other side of it. So you have the sympathetic, the go, 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 that's fight or flight. The parasympathetic is the whoa, Nelly, the rest and digest, the slow down mechanism. All right? While these are tremendous responsibilities, the nerve fibers that control all the functions only make up about 20% of the fibers of the vagus nerve. So thinking about that, the fact that it is controlling the heart, the lungs, the digestive system, the liver, the gallbladder, the spleen, the pancreas, and the kidneys, only 20% of its job. What's the other 80%? The other 80% are afferent, meaning they send the information back up to the brain. They relate it. Now that was so important when it came to that polyvagal tone theory by Dr. Porges back in 2011, is it is transferring that information all the way back up to the brain for you to then remember, for you to then respond to what's going on. How to stimulate your body in relation to how you are dealing with different situations and social interactions and strategies. So 80% of it is information back. It's not even doing the very thing. It's just telling the brain, hey, we need this. Hey, it needs that. Hey, we need to be doing this. Not really the fact of what most of the 20% is doing, which is to control it all, but main information going back up to respond to it. When I said about the fight or flight or the sympathetic, it's the body's natural physiological reaction to stress. So, we open the door and the dog comes screaming at you, barking, all right? We've got two options, fight or flight. Sympathetic nervous system fires, all right? Hormones are released that target the big muscles and the glands that it needs to survive. If we open that door over there, what happens is the dog comes sprinting out, starts barking at me, my body goes into get out of here mode, all right? Go, go, go. With that being the case, with the functions that are not immediately essential, shut down. Heart rate increases, lungs start to get more dilated, your pupils dilate, muscles contract, saliva, and cortisol is released. Cortisol and adrenaline, get the heck out of here. We gotta move, all right? The opposite of that, rest and digest, parasympathetic. So you gotta have one without the other. The go, 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 and the whoa nelly. Gas pedal, brake pedal. Think of it like a teeter-totter, gotta have it all. The body's response to controlling the balance and maintenance of the systems. You can't be going all the time. You need to have something opposite that. It restores the body to a state of calmness and counterbalances and allows the body to relax and repair. All of these changes are designed to maintain long-term health, improve digestion, conserve energy, and maintain a body's healthy abilities. All the opposite is happening there, okay? So everything goes back into its normal state. That normal state on where it goes up here and comes back down, normal state, is called homeostasis. That's what this nervous system is relying upon. So what happens to your vagus nerve does not stay in Vegas. It goes everywhere. It does. So you know the old saying, what happens in Vegas stays in Vegas? That's Las Vegas in the desert. What happens in Vegas in your body doesn't stay in Vegas. It sends the information everywhere back in order to counteract what's going on. That's what the polyvagal tone theory was. And it was doing it in order to tell your body that we're going to need things. But guess what? Chiropractic talked about it for 100 years. Over 100 years. Saying that our body needs to talk to itself, and it's constantly doing it in multiple ways. Like I said, 20% of it was just actually firing off those different organs to work. 80% of the time it was firing it back to say, hey, we need this stuff, we got to do this thing. It was constantly responding afferent information for it to say what we need in order to survive, to keep it going. So that's what the polyvagal tone was talking about, how your body survives and goes about. What I meant before when I said there's a very particular word in chiropractic care that was relating to, it's called innate. Innate, right? The innate ability of the body to understand what's going on and help itself. And chiropractic, again, has been talking about it for well over 100 years. The body's innate ability to repair itself and heal itself if everything is working in proper order. That's the crux of what chiropractic care does, and what it does involving the vagus nerve is huge. Okay? The problem today is that people are constantly stressed. They are too far in that sympathetic zone. There's go, 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 go. And we're not just talking about like one day where, you woke up early because you didn't sleep too well, you gotta have the 3 cups of coffee. You did work out because you were up early, you couldn't do anything else, so you went and worked out. Then you went to work was terrible, boss was a mess, come home, kids had a rough day too, still got dinner and laundry and everything else to do, plus it's only a Tuesday. All right, that's a one-off sort of thing. When I say that you're in a sympathetic zone, you are go, go, go all the time because cortisol is up all the time. You're always in a fight or flight mode. Your body feels like it's under constant attack and the rest and digest system can't come down. The go, go, go is going too fast. You don't have the ability to go whoa Nelly and slow down. So that is what we mean by when you're in a constant state of sympathetic tone. Easiest way for me to say is you cannot live in this place at the same time. All right? You're always in a fight or flight mode, means you're in a defense mode. Okay? You're always in a retreat mode. You're not living in a state of health, healing, and self-adaptability. It's like trying to drive with a handbrake on. All right? If you're trying to floor it right now, you can't do it. okay? You can't do it. You've got to have a balance of systems, homeostasis, all right? Like I said to you, what happens if Vegas doesn't stay in Vegas? And I'm going to show you research right now. And this is so cool in regards to it, okay? Because like I said, chiropractic has been talking about this for 100 years or more. Talking about how the body needs to be talking to itself in perfect rhythm and perfect synchronicity in order for you to live in a state of health, healing, and self-adaptability, just like the vagus nerve does. Like I said to you before, the brain-gut connection was a huge thing, all right, a few years ago. HPA access, all those sort of things, all right? What it was talking about was how the fact that if the brain and the gut are talking to each other properly, the body overall is working. Well, guess what coordinates it? Vagus nerve, 10th cranial nerve. A study from 2016 Gastroenterology Journal suggests that the vagus nerve is extremely precious, not only for homeostasis, keeping balance, but for a variety of organs, but for also the regulation of appetite, mood, and inflammation. So when you heard all those things online, all those influences, all those Good Morning America segments about how gut health, this is what they were talking about. That if your gut health is good and your microbiome is working good and your body is talking to itself better, then serotonin levels go up by 90% because that's what it's producing now. If you're eating rubbish and if you're hurting yourself based upon what you're eating, high inflammatory foods, for instance, too much sugar, too much bad stuff. Trust me, I enjoy all the bad stuff too, but doing it all the time ruins your gut health. Guess what? Your gut health is going to talk to your brain. Your brain's going to send some bad signals down, putting you in a state of sympathetic tone. Go, go, go. Too much stress. In chiropractic care, we talk about the 3 stresses of life, okay? Chemical, physical, and emotional. All right, chemical stress right there is your gut health. Okay, you've got to have constant communication, and if your body's been under constant attack in regards to it, that's why. Communication between the gut and the brain via the vagus nerve. More messages from the gut than from the brain. Leaky gut is something that causes inflammatory responses because of the fact that the body is not stimulating itself properly. It's not talking right. Okay, so this information that we're seeing here is the fact that it's not just chiropractic, it's also gastros talking about how this is. Again, that was in 2016. 100 years of chiropractic has been talking about this. What happens in Vegas doesn't stay in Vegas, like I said, okay? We're talking about here, the vagus nerve out of the National Review of Endocrinology. The vagus nerve is a major constituent of the inflammatory reflex that controls innate immune responses and inflammation during a pathogen invasion and tissue injury. What this is saying is the fact that our body, when it's under attack, the spleen's got to come in and help it. Well, guess what controls that? The vagus nerve, all right? The vagus nerve. Now, if we go back to our anatomy, guess where the vagus nerve is sitting? Right here, the first bone in our neck. That's why chiropractors take a trip to Vegas every year. Not every year, every single day, every single hour, every single patient, because of the fact that it has such a huge effect. So we're talking about inflammation, inflammatory responses. So we're talking about your immune issues. We're talking about those nasty bugs that are flying out there. I'm going to show you something in a second that's going to blow your mind. We're talking about how your inflammatory response and your body's response to things is based upon the vagus nerve talking to the spleen properly. As you can see, vagus nerve coming down, talking to the spleen releasing T cells, activating the macrophages. The macrophages excess inflammatory mediators, helping them with the joint space itself. What it's talking about is how the body is responding based upon an inflammation on the system, all based on the vagus nerve. Again, next thing, National Review of Endocrinology. Research suggests that the stimulation of the vagus nerve and its influence on metabolic pathways could also have a role in alleviating symptoms associated with metabolic syndrome and also type 2 diabetes. Think about that. The vagus nerve is talking about how insulin is going to be released within the liver. All right, okay? Talking about how the body itself is going to be regulated based upon diabetes, type 2 diabetes, one of the biggest killers in this country. The fact that, guess what's in charge of it? Vagus nerve coming from the, breaking down to the greater splenic nerve, all right? Thinking about the fact that, again, it doesn't just stay in Vegas, it's talking the whole time. The communication pathway is sending it back up through the loop, back to the brain. 80% of it is sending it back that way. Another study here from Coldstone Harbor Prospective Medicine. Recently, the vagus nerve stimulation has been investigated by a therapeutic multitude of diseases as treatment-resisted epilepsy, rheumatoid arthritis, Crohn's disease, and asthma. Because of the vagus nerve's innervation into the heart, the VNS has been identified as a potential therapy for cardiovascular disorders such as cardiac arrest, acute myocardial infarction, and stroke. Think about that. Vagus nerve stimulating the heart. That's what, again, the loop is going. So cranial nerve 10 comes all the way down to the heart, helps stimulate that, firing the axons that keep pumping the electrical impulses in order for blood to keep coming out. All right? It says it here. Signals sent down to the medulla of the brain stem, coming down throughout the vagus nerve, coming in, baroreceptors detect changes in the arterial pressure, sends it back up, the heart rate's adjusted. So think about that, the constant loop is literally showing it. So coming down here, baroreceptors detect changes in the arterial pressure, sends a message back up, 80%, again, sends it back up to the brain sends it down, says heart rate, we've got to change. So stimulation of the vagus nerve is sitting there saying the fact of what it can do in order to help RA, Crohn's, asthma, epilepsy, but also as an effective treatment for myocardial infarction, stroke, and for cardiac arrest. So again, we've hit kidney, we've hit spleen, we've hit liver, we've hit the heart now, okay? All of it doesn't just stay in vagus, it comes around the whole thing. This is what I was really cool and really excited to show you, all right? What happens in Vegas doesn't stay in Vegas. 2019, 2020, the world came to an absolute stop, all right? Coolest thing that we saw here in regards to the vagus nerve is what came out of it. This is so, so cool. COVID-19 courses range from mild symptoms up to multiple organ failure and death triggered by extensively high serum cytokine levels, all right? The vaguely driven cholinergic anti-inflammatory pathway, CAP, so cholinergic anti-inflammatory pathway, CAP, stops the action of the nucleus factor. We hypothesize that CAP detriment due to depressed vagal tone critically determines the severity of COVID-19. Break that down for you nice and easy, okay? That's the last part. We hypothesize through this research based from bioelectrical medicine that a vaguely it's saying the fact that if there is a depressed tone of the vagus nerve, so the vagus nerve is not firing properly, right? It is at a very low point. It will determine the severity of, if you have COVID, what your symptoms will be, from organ failure to a cough to the possibility of even death. That's incredible to think about. The vagus nerve, if it is depressed, can allow your body to run through it with COVID in your system to cause something as drastic as death. But something as high in vagal tone, if your vagus nerve is firing, your body has the ability to then talk to itself going forward and beat things like that and get through it. And from previous experience myself, having COVID, getting adjusted, having a vagal tone that's firing at its optimal potential, massive. But this being research is freaking awesome to see, like really awesome to see. Last one here, okay, in regards to what the vagus nerve can do. Based on the Journal of Oncology, based on all reviewed studies, it is concluded that the evidence supports that initially high vagal nerve tone activity predicts better cancer prognosis, particularly in the metastatic stage. Now, in this world, no one likes to talk about the C word. The C word is the worst thing that can possibly happen to anybody. It can cause catastrophic effects, not just for the person, but for the family members around them, let alone the journey that they're about to go on. How cool is it to see that there is journal evidence based on the Journal of Oncology that research shows that the fact that a high vagal tone or high vagal nerve activity predicts better cancer prognosis, particularly in the metastatic stage. That is pretty freaking awesome to see. The fact that cancer, high vagal tone, has a relationship in predicting the fact of a better outcome from there. So not only did we hit COVID, not only have we talked about the fact of diabetes, rheumatoid arthritis, stroke, inflammation, we're now talking about the fact of cancer. And like I said to you, chiropractic has been talking about this for over 100 years, how the body has to talk to itself properly all throughout this. And this is finally medicine coming around and talking about it in regards to their research about how vagal tone, based upon what that gentleman wrote in that book, and now it gave a light to everybody talking about how the vagal tone of your body needs to dictate things, how we've come so far that the body needs to start talking to itself based upon what the nerve type fibers are. As I said, 20% controlling the motor function, 80% sending the sensory information back in order to get information properly through the rest of the body. But like I said, chiropractic has been talking about it for over 100 years. And it's pretty awesome to see research coming out now. The fact that all those things that we don't like to talk about is finally being backed up through it. I got some questions to ask you, okay? Is your spine and nervous system essential for optimal health? I think we can all say yes to that after what I was saying. If the vagus nerve isn't firing properly for your different, what if the vagus nerve is not firing properly for your different systems or functions? Well, based upon all this research just here, I'd say it's a pretty big problem, right? Yeah, it would be. And last question I have for you, what if we could track to show the changes in your systems and functions that aren't symptom-based? All right. Yes, it is. You may not be able to fight off the stresses of viruses and diseases as well as you should. And yes, we can. Yes, we can track it without there even being a symptom involved. We're using our substation and to show the effect upon your system. I say that because here at our office, and like I said to you about chiropractic care, we're always talking about how our body is able to respond based on care and how we can show you what's going on. Okay, we've talked about the anatomy side of things, how the nerve is sitting here right next to the first bone in our neck, and how much chiropractors focus on that first bone in your neck. We take a trip to Vegas every single patient that we do, because of the fact that it's so important to be checking for those misalignments at that spot. But here's where we can show you what's going on and track it through data. An EMG measures the motor control of your system, okay? How much amount of energy it takes for your muscles to operate while sitting. Thermography shows me how much your sensory systems are done based on the temperature of your blood vessels. And finally, HRV shows me the effect of the buildup of stress in your body via the heart rate. These three things are known as the Insight Self-Fixation Station. We do them on every single patient. Every single patient, we track it from the day you start, 6 weeks into care, and show you the difference. And then we track it going forward. This system is designed to be a teeter-totter, so we're going back to that homeostasis. Go, 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 whoa, nally. Brake pedal, gas pedal, up and down, high and low. This system allows us to show what's going on. The scans allow us to show how the body is in a sympathetic or a parasympathetic state. Here is a patient of mine in regards to things, okay? He was a 34-year-old male with fatigue, neck pain, sinus problems, and he was going through the birth of his firstborn whilst under chiropractic care, okay? So his wife was pregnant, had an emergency, went to hospital, the baby was there in the NICU, then went to the PICU, so that's the newborn ICU, and then the pediatric ICU afterwards, there for about 7.5 weeks. He came in here, pardon me, with temperature scan just here on the left-hand side. You can see how much his temperature is up, right? This showed the nervous system is not firing in regards to it. All these things were showing us how well his body is adapting. The HRV showed me that his body just here is in a sympathetic state, which is what the vagus nerve does. It stimulates the fact of if you're in a sympathetic state or a parasympathetic state. Are you getting back to that rest and digest? Or are you just sitting in that cortisol state of sympathetic nervous tone? Lastly, his postural energy was lit up, all right? You can see how big and thick this is. The reason I show you these images is because your sympathetic nervous system sits in here. Your parasympathetic nervous system sits in here and here. Now his problem areas are lining up in regards to here, and similarly up here. Look what sort of symptoms he had coming on. He was fatigued, he had no energy, he couldn't rest. Neck pain started to come in because he was in such a sympathetic state. His body decided the fact that he needed to have more cortisol in his system. It was too go, go, go. Cortisol is shown to cause inflammation and build up. Pardon me, cortisol build up is shown inflammation build up and muscle tissue breaking down. It's also causing him to have sinus problems upstairs. Guess what? Cranial nerve in regards to it, okay? Olfactory, smell, all right? Still sitting here at that first bone in his neck, happening upstairs. See that? All of that happening upstairs. With that being the case, 6 weeks under care, this is what he turned out with. It went down to an 83 in regards to his temperature score. His postural energy has been taken from a 34 to a 74, all right? Temperature scan from 73 to 83. The coolest thing about it all is the fact of how his HRV went. Here is where he was before, pardon me. Here is where he was before, sitting in the sympathetic tone. Here he is in this parasympathetic tone, sitting at 85. So he took it from a 74 to an 85, shifting it from this point to this point. His body got into that rest and digest stage, allowing him to have better energy, allowing him to have less neck pain, allowing his sinus problems to clear up, and also the stresses that his body was going through. Think about this. Here's where the stress of it, things are going on, but a pretty darn significant thing happening in his life, this firstborn. That's where he's going to be sitting after 6 weeks of care. That is the power of the nervous system. That is the power of the vagus nerve and what's going on. And it's incredible to think that through chiropractic care, we can take that. Like I said, 100 years or more, talking about how the systems are relating to each other. Homeostasis, getting the body in perfect balance, allowing your body to thrive and respond to that innate ability that I mentioned before about how the body knows what it needs. And what it needs is that information pathway to be clear. 20% going down, telling it how to function, 80% going up, relaying the information about what it needs. So from the point of where we talked about how the anatomy sits in regards to that first bone, that's why we always check your first bone in your neck, to what the vagus nerve actually does when it gets down there, to how it affects all those organs, let alone the fact of how it's helping in regards to treating all those terrible things that are happening. COVID, diabetes, cancer, stroke, myocardial infarction, all those autoimmune diseases. It's so important the fact that, yes, they talked about the polyvagal tone back in 2011, how we were saying the fact that how our bodies need to be in constant communication with each other in order to respond well in regards to behavioral adaptation, social strategies. But now it's all about health. It's always been about health. And chiropractic has been talking about it for over 100 years. A big thing that we say here at the office is about activating your power. Without power, you can't do anything. You can go a month without food, you can go days without water, you can go a minute without air, but you can't go 1 second without nerve supply. The vagus nerve is something that we need to always be checking, and we check that to the first bone in your neck. All right? Allowing your body to best adapt to what's going on so that the correct information, function going down, and sensory information coming up to respond to it is key. And that's what we do here. That's what chiropractic care is all about, and how we always take a trip to Vegas. It's not just in the summertime, it's not just for the fast times and the good times out there to try and win some money. It's key that we go out to Vegas every single day with every single patient and make sure your bodies have the best ability to adapt, to self-heal, be healthy, and adapt. All right? Thank you so much again for coming tonight. I can't wait for next month's presentation and workshop. We're talking about back to school. We're going to be doing a back to school backpack workshop in regards to it, so please check that out. Please come and see us if you need anything at all. I'll take some questions afterwards, guys. But thank you once again, and I look forward to seeing you guys next month. Cheers.